Good day, everybody. This is your personal child specialist, Dr. Gaurav Gupta, MD. Today, we'll be talking about painless versus painful vaccination. Now, this might sound a bit odd to people who are based in US or Western countries, but in India, it's really a big question in private practice. Which vaccine should we give to our kid at 1.5, 2.5, and 3.5 months, and subsequently boosters? So we have two types of DPT vaccine available in India. One is the vaccine that causes more side effects like pain, swelling, fever, irritability, etc. And this was the normal DPT, which has been used for many years now. The newer DPT, which is known as the acellular DPT vaccine, this is the standard vaccine in most Western countries, and this was launched in India in the private sector quite a few years back, actually more than 10 years back, if I remember correctly. And this vaccine has entered into a fair amount of controversy, and this is because many authorities believe that this vaccine may not be as effective as the regular DPT vaccine. Now, there were many cases of pertussis, whooping cough, that were reported in Western countries like US, Australia, England, etc. And so there was a question mark about how good this vaccine really is. So this is the basis behind the two vaccines. And now I will just try to answer three questions which are commonly asked to me about this vaccination and what do I do in my own practice. So, coming to the first question, what is the difference between these two vaccinations? As I've already stated before, the difference is basically in terms of side effects. The normal DPT vaccine has a tendency to produce fever, swelling, irritability, excessive crying. All of this is much lesser when you use the painless DPT vaccination. But always remember, the word painless is not actually correct. I say it is a vaccination which causes less pain instead of being painless, because you can get some of these side effects with the so-called painless vaccine also. It is just that the frequency of these side effects is much lesser if you use the painless DPT or the acellular DPT vaccination. The second question which parents ask is this painless DPT having any disadvantages? Well, one is that it is more expensive, and the second is that it may be slightly less effective than the normal painful DPT. Now, why is this? Because the normal DPT has the entire bacteria of pertussis, which means more than 3,000 antigens. Antigens are the small proteins which are present on the bacteria, and they help in producing an antibody response, which means this is how you get your protection. Now, in case of normal DPT, the painful DPT, because the entire bacteria is being used to create immunity, you end up with more reaction, more side effects, and a good, robust immunity. As compared to this, when we talk about the painless DPT, there is less number of antigens being used, which means less reaction, but also possibly slightly less protection. Now, how much is the difference? That unfortunately is a matter of debate. Some people argue that the vaccine is as effective, while others say that it is very much less effective, but the consensus seems to be that it is slightly less effective. So, what I always tell parents is that when you look at these two vaccines, please remember that the painful DPT vaccine is used across the country for many years now. The painless DPT has been used in many Western countries for many years, including in their national schedule also. What does this mean? This means that both vaccines are effective, but the painful one might be slightly more effective. So, in an individual child, this is unlikely to make a lot of difference. So, two disadvantages: one is expensive, and second is slightly less effective. Beyond this, again, it is important to remember that fever, swelling, pain can all occur with the so-called painless DPT, but this is much lesser as compared to the normal DPT vaccine. I hope that answers the question. And now we come to the million-dollar question. What should I do for my baby? Well, so let me start by telling you what I recommend to the parents who come to me. I tell parents that at 1.5 months, you can take the normal, regular, painful DPT vaccine. Now, why is this? Because most kids don't have a lot of problem with the vaccine at 1.5, 2.5 and 3.5 months. The problem is more as the age increases, say for example at 1.5 years or at 5 years, when the DPT is likely to cause more reactions. So if you take the normal DPT at 1.5 years, you end up with a situation wherein the child is getting a vaccine which is less expensive and which is probably little bit more effective. Now, if the child doesn't have any problems with this vaccine, please continue with the same at 2.5 and 3.5 months. If the child has significant reaction which the parents are not comfortable with, I suggest that they can go for the painless DPT at 2.5 months. So I hope that's clear. Now, at 1.5 and 5 years, I give the choice to the parents after clearly explaining that the fever, pain and swelling would be more if you are using the painful regular DPT vaccine. This is my personal practice, and other pediatricians may have a different viewpoint, which is absolutely fine. There's nothing wrong with that as well. But this is what I suggest, and at 5 years, I normally end up giving the painless DPT because I don't like the kind of reaction which some children end up with the normal regular DPT. I hope this answers some of the common questions about the painless versus the normal painful DPT vaccination. If you have any further questions, feel free to contact me on my podcast page or through YouTube comments, and I'll definitely try to incorporate these in my comment section. This is Dr. Gaurav Gupta, your personal child specialist, signing off. Till the next time, take care.